एनाटॉमिकल पोजीशंस के बारे में बताया था, फंक्शनल पोजीशंस के बारे में बताया था, एंड मेजर मसल ग्रुप फ्रॉम फ्रंट, एंटीरियरली एंड पोस्टीरियरली, फ्रंट एंड बैक, जो मेजर मसल ऑफ द बॉडी, वो आपको मैंने पिछले लेक्चर्स में बताया था. नाउ टुडे वी विल talk about the skeletal system. In skeletal system, before coming to the skeletal system, we just recall the systems, how the system is formed. Atom combines together and form molecules in this picture, and tissues are made up of molecules. Similar type of tissues are made up of molecules. Similar type of cells form tissues, and different type of tissue form an organ, and different organ they work together and they form system. So you all know that musculoskeletal system, because in musculoskeletal system we are talking about the muscle, joints, tendon, ligaments, and bones. This picture shows the musculoskeletal system: muscles, bones, cartilage, ligaments, and tendons. So these are the structure who they work together and form a system called musculoskeletal system. This musculoskeletal system, it helps in supporting and protection of the body. Come to the skeletal system. The basic component of skeletal system is the bones, joints, and adjacent cartilage. The basic component, skeletal system का जो basic component होता है वो bones होती हैं, joints होता है, और joints के adjacent cartilage, जिसको मैंने पिछले लेक्चर में बताया था, cartilage are the avascular structure, जिसमें blood supply बहुत कम होती है, poor blood supply होती है. Then function of skeletal system, just to support and protection of the body, movement, and in skeletal system or in the bones there is a production of the red bone marrows, blood cell production, and mineral storage, calcium and phosphorus. Calcium and phosphorus, you all know that the bones are made up of calcium and phosphorus, and the storehouse of the calcium and phosphorus is the bone. Our skeletal system is divided into two. As a whole, our skeletal system is divided skeletal system is as a whole divided into two: axial skeleton and appendicular skeletons. Axial skeleton में skull, vertebral column, sternum और ribs आते हैं. Appendicular skeleton में shoulder girdle, pelvic girdle, अभी आवाज नहीं आ रही है? Skeleton, shoulder girdle, pelvic girdle, upper limb and lower limb. Now come to the skeleton as a whole. These are the major bones of the skeletal system: cranium, skull, mandible, then clavicle, shoulder blade, scapula, then humerus, radius and ulna, sternum bone, then ribs, hip bone, carpals, metacarpals, phalanges, tarsals, metatarsals, tibia, fibula. patella, and femur. So these are the whole skeleton, and these are the bones of our skeletal system. So bones types in our skeletal system, there are different type of bones. Previously, I have seen that these are the bones, and there are the types of the bones which are in our skeletal system. Some bones are short bones, some bones are long bones, some bones are flat bones, some bones are irregular, and some bones are sesamoids. Sesamoid bones, basically sesamoid bones are the bones are embedded within tendon or muscles. So these are the following type of bones: short bones, long bones, irregular bones, flat bones, and sesamoid type of bones. Flat bones of the internal organ, they protect the internal organ of the body. Flat bones protect the internal organ of the body. Or flat bones may cranial bones, bones of scapula, sternum, and ribs. These are the bones, they are in category of the flat bones in our body: sternum, ribs, cranial bones, and scapula. They protect our internal organs. Long bones. Long bones in our body: humerus, femur in lower limb, forearm bones, radius and ulna, and in our leg, tibia and fibula. Tibia and fibula. These are the long bones in our body who they support weight and facilitate movement. Long bones, they support weight and facilitate movements. Short bones are cup-shaped, and short bones are generally, they are in our wrist and ankle. They are known as carpals and tarsals. These are the short bones in our body. Then irregular bones, vertebrae and sacrum. Vertebrae and sacrum, these are the irregular bones in our body. So short bones, long bones, irregular bones. Then sesamoid type of bones in our body is patella. As I told you that sesamoid bones, these are the bones embedded within tendon or muscles. And the main function of sesamoid bone is to just decrease the stress on the tendon. These bones, they help in decrease the stress of the tendon. These are the different joints in our body. There are different type of joints in our skeletal system as a whole. As you see in this picture, shoulder joint, elbow joint, hip joint, knee joint, ankle joint. So these are the different type of joints in our body. The first one is ball and socket type of joint. Ball and socket type of joints of the shoulder. Shoulder is a ball and socket type of joint. In such joints, there is a movement in all directions. In shoulder joint, movement takes place in all directions. Shoulder joint is a ball and socket type of joints in which the movement takes place in all directions. Hip joint is also a ball and socket type of joints. Hip joint is also a ball and socket type of joints, and in this joint, movement take place in all directions. Whatever the movement takes place in the hip joint, they are in all directions. Whatever the movement takes place at this joint, the movement is in all directions. Now come to the elbow joint. Elbow joint, you can see in this joint, it is known as a uniaxial joint, or you can say uniaxial, or there is a only one directions movement take place in this joint, or you can say in one plane. Elbow joint is a hinge type of joint where the movement takes place in one plane or in one direction, and it is a uniaxial joint. Elbow joint is a uniaxial joint. Then come to the knee joint. Knee joint, it is also in the category of the hinge joint, and in this joint also the movement takes place in a one plane uniaxial joint, and the movement takes place in one directions. Bone of the femur, tibia, and fibula, they form a joint that is known as knee joint. Then metacarpophalangeal joints. Metacarpophalangeal joints. Metacarpophalangeal joint is a condyloid type of joint. It allows movement but no rotation. Metacarpophalangeal joint is a type of condyloid type of joint where the movement takes place but there is no rotation in such joint. MCP, metacarpophalangeal joint. MCP, metacarpophalangeal joints. Then pivot type of joint. Pivot type of joint is a joint where there is a only rotary movement takes place. Rotary movements takes place at one bone, that that glide over others, and such type of joint, pivot type of joint, is in radius and ulna bone. It's a forearm bones. Radius and ulna, there is a movement called radio ulnar joint, and there is a movement, supination and pronation movement takes place in this joint, and that joint is known as radio ulnar joint. And in this picture, this is the first vertebra, and first vertebra atlas and second vertebra that form a joint, and this joint is a pivot type of joint in your neck. This type of joint is in between the first and second vertebra of the neck. Then gliding joints. Gliding joints, one surface glide over others. Ankle and wrist joint. Ankle and wrist is a type of joint where there is a gliding movement takes place in the small bones, carpals and tarsals. And there is a movement takes place. Then saddle type of joint. Saddle type of joint, it does not allow any rotations. but it enables movements front, back, and side to side movements. And this joint where the movement takes place, the movement takes place at the base of the thumb. Saddle type of joint, movement takes place base of the thumbs. So there is a movement, enables the movement back and forth and side to side, but the movement takes place at the base of the thumbs. So thumb is a base of the thumb where the movement takes place. Such type of joint, this type of joint is known as a saddle type of joint. Now come to the bones. The bones of the human skeleton. The total bones in our body are 206. Total bones in our human skeleton is 206. And these bones are comprises the whole skeletal systems. In skeletal system, previously we discussed the different type of bone types, short bones. Calcaneus is the short bones category, long bones, femur, flat bones, scapula, irregular bones, spine. And in bones, there are two types of bony tissues, spongy tissue and dense tissues. And bones are the composition of calcium and phosphorus. Bones is made up of calcium and phosphorus, and there are two types of bony tissue, spongy and dense. And the bone cells types are osteogenic cells, who they are responsible for the fractures. And osteoblasts are responsible for bone formations. Then osteocytes are the mature bones, and osteoclast, these are the bones who they help in healing and remodeling during the breakdown of the bony tissue. So there are four types of bone cell types: osteogenic, osteoblast, osteocytes, and osteoclast. One is respondent to the fractures, some are responsible for formation, some are for healing and remodeling, and osteocytes are the mature bone cells. In this picture, you can see the osteocytes maintain bone tissues, osteoblast forms bone matrix, osteogenic cells are the stem cells, and osteoclast who they resorbs the bones. Now come to the axial skeleton, as we have discussed earlier. जैसा हमने पहले बताया कि axial skeleton में bones of the skull, vertebral column, sternum और ribs आते हैं. Axial skeleton में bones of the skull, vertebral column, and sternum and ribs आते हैं. There are 22 bones in our skull. In vertebral column, there are 26 bones, जिसमें सर्वाइकल रीजन, गर्दन वाले हिस्से में 7 होती हैं. इन thoracic 12, lumbar 5, sacrum 1, and the coccyx fused, that is 1. So total bones in vertebral column are 26. Skull 22, in vertebral column cervical region में 7, thoracic region में 12, lumbar region में 5, sacrum में 1, and coccyx 1. There are 12 pair of ribs, and the total is 24. Then there is a chest bone, you can say sternum. One is a hyoid, and middle layer 3, both sides 3 into 2, 6. So if we count the total bones in our axial skeleton, there are 22 skull, 26 vertebral columns, 24 ribs, one is sternum, one is heart, and there are 6 bones in the middle ear, and the total count is 80. So there are 80 bones in our axial skeleton. मतलब स्कल, वर्टिब्रल कॉलम, स्टर्नम और रिब्स को मिला के एक्सियल स्केलेटन में टोटल 80 बोन्स होते हैं. नाउ कम टू द अपेंडिकुलर स्केलेटन. अपेंडिकुलर स्केलेटन में आपका शोल्डर गर्डल, पेल्विक गर्डल एंड बोन्स ऑफ द अपर लिम्ब एंड लोअर लिम्स आते हैं. शोल्डर गर्डल जिसको हम स्कैपुला भी बोलते हैं, एंड पेल्विक गर्डल जिसको हिप बोन भी बोलते हैं. सो शोल्डर गर्डल both side 2 scapula, clavicle 2 humerus bones of the upper arm, 2 radius, 2 forearm and ulna 2. There are 8 carpal bones and both side 8 into 2 16. Then metacarpals, there are 5 metacarpals and both hands 5 into 2 10, and phalanges are 14. In each finger 3 and a small finger is, or you can say little finger 2. So it is total 14 into 2 28. So in appendicular skeleton, shoulder girdle में pelvic girdle, upper limb and lower limbs. So upper limbs scapula, clavicle 2, humerus 2, radius 2, ulnar, carpal 8 into 2 16, and metacarpal 10, phalanges 14 into 2 28, and total 64 bones in our upper limb. Now come to the lower limb, hip bone. Hip bone, both side 2, femur 2, that is the longest bone in our body, patella 2, tibia 2, fibula 2, and tarsals, there are 7 tarsals bone, and in upper limb there are 8 carpal bones. So 7 into 2 14, metacarpals 5 into 2 10, and phalanges 14 into 2 28. So total bones in lower extremity is of 62. So 80, 64 plus 62. So total bones in our skeletal system is 206. These are the differentiation of the different limb, upper limb, lower limb, and axial skeleton. So total bones in our body is 206. See in this picture, this is the skull, and you all know just now that there are 22 bones in our skulls. In vertebral column, as I have told earlier, there are 7 cervical vertebra. In a picture view, you can see and understand 7 cervical, 12 thoracic, 5 lumbar, sacrum 1, and coccyx are fused and they are counted 1. So there are 26 bones. Then come to the chest area. There is a ribs. There are 12 pair of ribs. जिसमें 1 to 7 ribs are the true ribs, 8 to 10 are the false ribs, and the last 11 to 12 ribs are the floating ribs. In this picture, the lower part of the sternum is known as xiphoid process, and the upper part of the sternum is known as manubrium. Upper part of the sternum is known as manubrium, and the lower part is a xiphoid process. Scapula. This is scapula, both sides, two scapula, who they form glenoid cavity of the scapula and the head of the humerus. They form a glenohumeral joint. See, in arm, the upper arm, humerus and the radius and ulna, forearm bones in a picture view. Then carpal bones. As I have told you earlier, there are 8 carpal bones. In one hand, there are 5 metacarpals and there are 14 phalanges. Proximal phalanx and distal phalanx. Proximal away from a point of the reference and distal. Proximal is towards the point of the reference and distal is away from the point of reference. Then this is the hip bone, both sides. There are 2 hip bones. Now come to the lower limb, bones, femur, both sides. Then patella. And patella, as I've told you, this is a sesamoid type of bones, who they are embedded in the tendon or in the muscles. The main function of this patella bone is to decrease the stress on the tendon. Then the lower legs bones, tibia and fibula. This is one of the tibia is one of the strongest bone. And lateral side, you see this fibula bone. Then talus, an ankle joint. There are 7 tarsal bones, calcaneus and talus. You can see in the pictures, and there are 7 tarsal bones and 5 metatarsal. Again, there are 14 phalanges. So joints of the upper extremity. In upper extremity, from sternum to the clavicle, there is a sternoclavicular joint. Then acromion process of scapula and clavicle, they form a joint called acromioclavicular joint. Then glenoid cavity of the scapula and the head of the humerus form a glenohumeral joint. This is form shoulder joint we bolte hain. Then in upper extremity, there is a elbow joint, radius and ulna, who they form a very shallow type of joint. This is a gliding joint, as I have told you. This is a gliding type of joint, radioulnar joint. Then carpometacarpal joints. These are the joints, carpometacarpal joints. Then metacarpophalangeal joints and interphalangeal joints. So these are the joints of the upper extremity: sternoclavicular, acromioclavicular, glenohumeral, elbow, radioulnar, carpometacarpal, metacarpophalangeal, and interphalangeal joint. The joints of the lower extremity: hip joint, knee joint, ankle joint, and tarso-metatarsal joints, metatarsophalangeal joints, and interphalangeal joints. So hip joint, knee joint, ankle joint, tarso-metatarsal joints, metatarsophalangeal joints, and interphalangeal joints. So these are the joints of the lower extremity. Now come to the directional references. In our human body, there are some directional references anteriorly. Anterior means front, or you can say ventral or belly side, पेट की तरफ. Posterior means back, or you can say dorsal side. Then medial near the midline. Then lateral away from the midline. Superior towards the head. These are the terminology, directional terminology. Anterior matlab front, posterior matlab back, median matlab near the midline, and lateral means away from the midline. Superior towards the head. then inferior below or towards the feet. पैर की तरफ inferior और head की तरफ superior. Proximal near the point of reference, or you can say towards the body. Then distal further from the point of reference, away from the body. Superficial or peripheral or outside. Superficial, as I have told you in our muscular system, that you can point it out, our muscles superficially, means you can point it out from outside. So superficial, or it is also known as a peripheral, or you, in other words, say outside. Then internal, within or inside, and external means outer surface. These are the directional references. Then action terminology. And this action takes place at the joint flexion. This is you might have been such lecture in your biomechanics class also. Flexion, when there is a decrease in the angle of the joint, is called flexion. जैसे हम elbow joint को, यदि हम elbow को मोड़ते हैं, तो there is a decrease in the angle of the joint, so it is called flexion. यदि हम elbow को सीधा करते हैं, then there is a increase in the angle of the joint, it is called extension. Any movement beyond the normal anatomical range is known as hyperextension. Any movement beyond the normal anatomical range is called hyperextension. Then there is a word abduction. Abduction means away from the midline. Away from the midline. Then adduction means towards the midline. Adduction means towards the midline. Then supination. Supination and pronation, as I have told you, that this movement takes place at the radio-ulnar joint. Supination, in this position, there is a palm up. या आप कह सकते हैं beggar position. भिखारी जैसे भीख मांगता है. Beggar position is called supination. Pronation is just palm down, or you can say a blessing position. जब हम किसी को bless करते हैं, this is called palm down, and this action is known as pronation. Then dorsiflexion, and this dorsiflexion and plantar flexion movement takes place at ankle joint. In this dorsiflexion, toes are pulled up and flex the ankle. Toes are pulled up. Dorsiflexion, जैसे हम ankle का movement करते हैं, then toes are pulled up and they flex the ankle, and this movement is known as dorsiflexion of the ankle joint. Then plantar flexion, toes pointing towards the ankle, toes pointing downwards. Toes pointing downwards means they extend the ankle. When they flex the ankle, it is known as dorsiflexion. When they extend the ankle, then it is called plantar flexion. Then the other movement takes place at the ankle joint is inversion and eversion. Sole of the foot turned inwards. When the sole of the foot turned, or you can say heel, so that turned inward, it is known as inversion, and eversion means sole of the foot turned towards, sole of the foot turned outward. So inversion and eversion, inversion foot turned inwards and eversion foot turned outwards. So these are the different movement takes place at different joints, and these are the action terminology. So in our musculoskeletal system, muscle, joints, bone, tendon, ligaments combined together, they form a musculoskeletal system. And musculoskeletal system को हमने दो पार्ट में जो है कवर किया, मस्कुलर सिस्टम और स्केलेटल सिस्टम. मस्कुलर सिस्टम में हमने मसल्स के टाइप्स एंड मसल्स का फंक्शन क्या होता है उसके बारे में आपको बताया. देन क्या क्या मेजर मसल्स हैं और क्या डिफरेंट anatomical position है, functional position है. Then in our today's lecture, skeletal systems में bones of the human skeleton, total bones कितनी हैं, सारे bones के नाम, different bones के नाम, कितने bones के types हैं. Then what is the role of the skeletal system? The main role of skeletal system that enables the movement, provides protection for the organ and internal structure. There is a formation of the blood cells, produces blood cells in the bone marrow, stores minerals, calcium, phosphorus, sodium, and manganese. And this skeletal system provides attachment for the muscle. So finally, we can say that skeletal system, it enables movements, provides protections for organ and internal structures. There is a formation of the blood cells in bone marrow, and there is a storage of calcium, phosphorus, and sodium, manganese in the bones, and it provides attachment for the muscles. So this is all for skeletal system. Thank you very much.